This is Kuldeep Chaudhary reporting for Health in India. I'm at the main reception of RV Hospital. This is a 100-bed surgical specialty hospital in Gurgaon, Haryana, India. And we are here to cover the story of a patient who has just been operated for a sinus surgery. It was an endoscopic sinus surgery which was done by the renowned ENT surgeon, Dr. Ravinder Gera. Why this case is interesting is because this patient didn't come to India for treatment. He was here as accompanying his wife, who had come to RV hospital to get a surgical procedure which was not available in Nigeria. It was the removal of ovarian cysts while protecting the ovaries. While accompanying his wife, the patient mentioned to the doctor that he's suffering from sinus which is irritating at times. So the patient was sent to Modern Diagnostics to get an X-ray done. On the findings of the X-ray, the ENT specialist advised to go for an NCCT PNS region, which confirmed that the patient had a DNS on the right side with a nasal spur. Immediately it was decided to do a surgery on the patient. Since they didn't have too much of the money left, the hospital suited their budget, and for just a very small amount, the patient has been operated. This afternoon, the surgery has gotten over just about 10 minutes before. Dr. Ravinder Gera has just left the hospital after doing the procedure, and the patient is going to be discharged this evening. So now we'll be talking to the patient and finding out why did they choose RV Hospital and what were their reasons for choosing Health in India as the preferred facilitator for getting treatment in India. I'm in the clinic of Dr. Ravinder Gera, one of the most renowned ENT surgeons in the city of Gurgaon and the entire NCR region. We are talking to Dr. Ravinder Gera about one of the most complicated surgeries that he has done on a Nigerian patient. The procedure was endoscopic sinus surgery. Let us try and understand what exactly this procedure is. So Dr. Gera, this Nigerian patient, you saw him a couple of days back and advised him to get an NCCT for the PNS done. So what exactly was the problem with the patient?
The patient was actually having the sinus problem. He was having the deviated nasal septum along with the involvement of the frontal, maxillary and ethmoid sinusitis. On the radiological investigation, it seems to be like allergic fungal sinusitis, and patient was suffering from headache, post-nasal drip, nasal blockage, for which we have planned the endoscopic sinus surgery in this case.
So you just finished the surgery, I think 1 hour back, and the patient is fine now. I just met the patient. How difficult is this procedure?
See, if technically it is a difficult surgery, if it is done meticulously, it's done endoscopically most of the time, and we open all the sinuses. It's not that easy surgery, can't be done in small setups, but still we have done in a nursing home in a RV hospital, which is a very big hospital, medium-sized hospital, and with all kind of facilities there out. With all video recording and everything we have done it, and hopefully this will give a good result to the patient.
This morning the patient was a little worried about the facial scar that he would have. So is this a big scar that is left behind after the surgery?
See, in endoscopic sinus surgery there is no scar left on the face of the patients. We do all through an endoscopic approach, so there is no scar left on the face as such.
That's wonderful, because I told the patient it would be a very minimal scar.
No scar at all.
Okay, that's great. You might be knowing this patient actually didn't come to India for treatment for himself. In fact, he was accompanying his wife, who was here for an ovarian cyst surgery, and incidentally the patient suddenly remembered that the sinus is something which has been irritating him for several months, and then you saw the patient and got him investigated, and now the surgery has been done. In the same visit, both husband and wife have probably got rid of their problems. So what qualitative difference this kind of surgery will make to the life of the patient?
Definitely, patient will improve in all regards. He will have a good breathing passage. He will be able to breathe in a much better way out. He will be able to sleep in a very peaceful manner. Secondly, he will not have the headache. He will not have the post-nasal drip. and he will not have, means there are no chance of complication now after surgery, which can occur because of the allergic fungal sinusitis.
Okay. In fact, the patient, since was not carrying a lot of money, the money that they had got was only for his wife's surgery. So we told the patient that Dr. Gera performs the surgery at all the top-end hospitals of Gurgaon, Artemis, Max, Paras. So if he's going to operate upon you at a smaller hospital, you're probably going to save a lot of money, which he actually did. So basically, can all of these ENT surgeries be done at the medium-sized hospitals?
Yes, it can be easily done, because we are doing for the last couple of years, maybe around 7 to 10 years, we are doing all these ENT surgeries in small setups. Even we have done in a cochlear implant in a very small setup. So it is very easy to do all these endoscopic sinus surgery in small setups. By doing surgeries in small setup, we can save the cost of the patient, because in big hospitals like Artemis or the other hospital, the charges for endoscopic sinus surgery is more than 1 lakh. So it is better to do it in the small setups if patient can't afford.
So basically, what you're trying to tell us is that since India has wonderful surgeons, people like you have done more than 20,000 surgeries, so even the medium-sized hospitals can look at international patients, and thereby India can offer a complete spectrum of pricing for the international patients, so that we'll be able to tap not only the rich people in these countries, but even some of the people who can't afford a lot of money. Is that what you're saying?
Yes, we should, and we are doing, and I think that third world countries or the other countries who can't afford the expensive treatment in our corporate hospital, they can easily have benefit from getting the surgery done from these small hospitals. They can save the cost and everything.
So in the field of ENT, what all surgeries are being done, and what can be done with very good results at the Indian hospitals?
See, all these ENT surgeries like micro ear surgeries, endoscopic sinus surgeries, endoscopic CSF rhinoria repair, cochlear implant surgeries, head and neck cancer surgeries, these are the major chunk of the surgery which we are doing routinely in our hospital, and they give good results most of the time.
And what we've come to know from our information is that when it comes to doing a chunk of the surgeries using the endoscope, you are in the forefront. What are the big advantages of doing most of the surgeries using endoscope?
See, endoscope is definitely a traumatic kind of procedure. Doing a endoscopic surgery, in these cases, the patient has to live in the hospital for a very short time. Patient's recovery is very fast, and the charges are not that, means from the conventional surgery to the endoscopic sinus surgery, there is not much of the difference in the cost. So it is better to go for the endoscopic sinus surgeries.
So primarily now the patients can plan, a 1 week visit to India, and their hospital stay would only be 1 or 2 days?
Yeah, we keep the patients in cases of endoscopic sinus surgery in the hospital for 1 day only.
1 day. So Mr. Olukunle, you operated him I think at about 4 o'clock. So he can go back home tomorrow morning.
Yeah, tomorrow morning we will discharge this Nigerian patient, Olukunle, and I think hopefully he will have a good time after 2-3 days.
So thank you, Dr. Gera. You've done a wonderful job, and the family is pretty happy. Earlier the wife was operated by Dr. Vikram, and now the husband has been operated by you. They've got great regards for you and for RV Hospital. Thank you once again. So this patient, Olukunle, who was in India accompanying his wife, has now got operated at RV Hospital. And this was just, his surgery costed him just the spare change which he had bought and still got money left for doing a lot of shopping. He's going to be discharged, as Dr. Gera just now told, tomorrow morning. And lots of Nigerian patients, Iraqi patients, patients from all parts of the world can now take advantage of the very advanced Indian healthcare system. The costs are extremely low, and when the patients come to India, they can carefully select the doctor and the hospital They are very, very good surgeons in India, and one of the best way of finding the best doctor and the best hospital is to log on to www.healthinindia.com, which has all the top-end hospitals. It has got the lowest price for your procedures, so you can email your reports to info@healthinindia.com. This is Kuldeep Chaudhary reporting from Health in India. Thank you.